and see if he's going to say ouch at any point. Then I'll make a special point for the costo-vertical angles. So you've got to be pretty firm and hard. Don't be gentle. Gentleness will get you nowhere. Okay, so you've got to be firm and hard. Okay, so where does it matter? People with kidney infections, costo-vertical angles matter. Okay, so that is the second part of examining the back. Now, does anyone have a measuring tape? Can you turn around this time this way, please? So, no, face the audience. So we're going to measure his chest expansion. That's an objective measure. Nobody with a chest tape?
She's getting it.
She's finding it. Okay. Awesome. Thank you.
Oh, sorry.
Whoops, oops.
There you go.
Yeah.
So, you have to take it at the level of the nipple. Okay, in case of the women, you have to go around the breast at the level of the nipple. Okay? What we are looking for is the degree of expansion, not the actual chest size. Okay? So, be sure you measure in inches, don't use the centimeters and you'll get into trouble. Okay? So, I'm going to measure your chest expansion. Okay, so now give him a couple of trial runs so that he knows what to expect. Take a deep breath, the biggest you can take. Maximum breath. You're not breathing deep enough. Take the biggest breath you can. And breathe out totally. Exhale totally. Okay? Now, okay, take the biggest breath you can take. And he has about 2 inches of chest expansion. So you got to give him 3 runs and pick the best. Okay? So as I said, average is around 2 inches, 2 to 2.5. That's cool. If it falls below 1.5, that means there's a restricted chest expansion. Okay?
So, Dr. Mandy, you can actually put it like below, like the chest,
No,
because you had it
just
like a little below his nipple.
Yeah, it slipped a bit, but try to keep it there.
Okay.
It's not exactly that. Okay.
Okay.
All right, so then that's the first part of the story. Now, next comes the palpation. We are palpating for vibrations, okay? So always make the patient turn his head away from you. You don't want his germs on your face, okay? So we'll ask him to open his mouth. No, before that, ask him to say 99 and keep saying till I ask you to stop. Okay? Can you start?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, well, stop for a moment. So you saw that I went zigzag. You always had to compare. Don't go vertically down. Right, left, left, right, right, left. There's hardly any lung below this level. So you'll get most of the information there. And if you think there's something wrong with this side, ask him to put his hands above his head. Can you put your hands above your head? Both hands. Then say 99 again.
99, 99.
And now I want you to turn around and continue saying 99. This for demo purposes only. Okay? You don't have to turn around in your exam. Okay? So hardly you can get any vibrations where the scapulas are. So you're going to go above the scapula, below the scapula, in between the scapulas. Okay? Say 99 again.
99, 99, 99, 99, 99, 99.
So you always compare. So I use the back of my hand, so you have sensitive. You can use the ulnar bar of your hand if you like, or the palmar surface, whichever is your most sensitive part. So some people do both hands at the same time, so it's your choice. There's no hard and fast rule. So I prefer doing it because it gives me instant comparison with the same hand. But if you want to do it with both hands, that's fine. Okay, that's for tactile fremitus. That is, the voice produced in the mouth travels through the bronchial tubes and transmitted to the chest wall. So it's the sort of gives us the idea of the degree of conduction. So for example, in pneumonic or solid lungs, the conduction is better, so you get increased tactile parameters. People with a collapsed lung, there's a hollow space, no lung tissue, so there will be no vibration. Again, people with fluid on the chest, it dampens the vibration, so no vibrations, okay? Then, I want to turn around again. I'm sorry I'm making all the exercise. Okay. Now with the all-important technique of percussion. If you have hammered a nail, you know how to percuss, right? So the same techniques. You've got to drop the wrist, not your fingers. That's the key. So remember, there's a bit of lung on top, on each side. And then, so you do supraclavicular percussion, infraclavicular percussion, and upper chest and portion of the chest above the nipples. Okay? 1, 2, 3, 4 areas for percussion. And the same 4 areas you're going to use for auscultation. Okay? So, because the lung is vertical here, you can't go horizontal. So you have to use your non-dominant fingers to stretch the skin. Okay? And use your dominant fingers to tap. So the middle phalanx of the finger you're stretching the skin with, that's what you're going to tap. Give yourself time to hear the sound traveling back. Don't go fast like that. And if your one finger is not good enough, use 2 fingers. If you want your dainty finger, use 2 fingers to tap on. So that's your choice. And then you can tap on the clavicle without your fingers. That'll also give an idea of the lung underneath that. Then don't percuss on the ribs. Go in the spaces between the ribs. So he's a highly muscular guy, so there's a bit of dampening of the sound, which is normal. Now I want you to put your hands on your head again. Compare the sides. Then lower your fingers. I'm sorry, you got to turn around again. A lot of exercise for you today. All right. So in the muscular chest walls, you can't find much great resonant sounds, okay? So above the scapula, but you are likely to find not much evidence by percussion on the back, okay? So now we've done with the inspection, percussion, palpation. Next is the auscultation. Okay, so when we got him on his back, be there, we'll examine the back first. So always wipe the chest piece in front of your patient so that he knows you're not using a dirty stethoscope. Seeing is believing, okay? So there you go, Lou, it's clean. And I have to clean my earpiece because not my stethoscope. If it was mine, I don't have to clean it, okay? And how do you insert the earpieces into your ears? Going forward. So I'll watch you doing it. If you don't insert right, you'll lose a point. Okay. Make sure this end is connected. Okay? Now, I want you to turn your head to us. Okay, now, all right. You can. Now, ask the patient to cross his shoulders on both sides. That will open up the back so it can hear better. Okay? Now breathe in and out. Open your mouth and breathe through your mouth. In and out. You got to hear one complete cycle. Inhalation, exhalation. His air entry is good. Both the inspiratory phase, expiratory phase is crystal clear. So what's the quality of a normal vesicular type of breath sound? Imagine yourself standing in a cornfield and the wind rustling against the corn. What kind of sounds you hear? That's what you should hear in a healthy chest. Okay? Once you're satisfied, the inspiratory phase is good, expiratory phase is good, then you have to listen for added sounds like crackles and wheezes. Okay? Now if you can turn to the front this time. So we're going to listen again to the front in the same fashion. Turn your head to one side and breathe in and out. Here it may be difficult with the chest piece, so we may use a belly. Okay. Then we come to the infraclavicular regions. Okay. So 3 areas or 4 areas on each side and 3 areas in the back. And if you're worried, on the sides. Okay? So you're listening for inhalatory phase, acceleratory phase, and any added sounds. All those qualities must be noted in your charts. Okay? Now, let's assume he's a lady, which he's not, but we'll see how to drape a lady. You got to learn how to drape ladies. So give them a gown. So put your hands through this. Oh, sorry. Okay. All right. So you will tell the patient, I'm going to loosen the top of your gown. And now use your hands to pull it down yourself so that you cover areas up to your breast tissues. Okay? So that way, you are not touching the breast. Is that where your breasts are? All right. So hold it there, okay, so that it doesn't fall off, okay? So that he knows. Then you can examine. Then thank you and ask him to pull it up. And if you want to listen to the bottom of it, ask him to pull the gown up, lift the breast up, okay? Then you can listen to the bottom. That's very critical. If you don't do it, you'll miss a lot of things. Not so much for the lungs, but when you come to heart examination, see there are 2 areas are on top, 2 areas are on the bottom. So in case of a lady, listen on the top, then when the gown is down, ask them to pull it up, and then listen at the bottom. So this draping is essential to do chest exam. Yes.
For the lung, for a lady,
Yes.
like, do you always have to have them have the gown on?
I would recommend it.
Okay.
Don't try to slip something under their clothing.
That's not enough?
No, that's not enough. Okay. Because you're going to do needling anyhow, right?
Possible.
Yes.
I mean,
So-
it's not always that we do the chest, so we don't always have them disrobe, so. just-
All right.
Yeah.
So what I described so far is a detailed chest exam. Then we come to the end of all this. Once you finish the belly exam, what is a focused exam? Which you don't have to do all this rigmarole. But you will have to do them if you found something. If you don't find, you just auscultated, that's the end of the story. So that's 2 sets of exam. One is called a focused exam, other one is a detailed exam. So detailed exams are reserved for a specific problem, belly problems, lung problems, heart problems, or head and neck problems. Then you go on the detailed exam. Otherwise, I'll just shine a light in his nose and I'll look up his nostrils, look down his conjunctiva, tug on his ears, and then do a sweep. Okay, you don't need to do all the other things. Depends on the students, okay? All right, so any questions? With all the explanations, it took me 5 minutes to do it. So without explanations, you should be able to do it in 2.5 minutes flat. That's the goal. Because time is money. You don't have a whole 1.5 hours to just listen to the lungs. and nobody will pay you anything, okay? So remember, efficiency, speed, accuracy, all are important. Good, so let's go to work. And Sandra